Nigeria's first specialized health program where medical doctors consult for free and advise on Your Women Radio. And of course, it is being broadcast at 10 a.m. Mondays through Fridays. Our radio doctor for today is live right here with me in the studio. So you can actually join the conversation via our social media platforms at WFM 917 Facebook, Instagram, YouTube. WFM 917. You can also live stream the program via our website at www.wfm917.com. Right, at www.wfm917.com. Listen live from anywhere and of course at any time. My name is Blessing Hamilton. Joining me on the conversation today is our radio doctor, Dr. Abiola Ajayi, the MD CEO of ROA Specialist Hospital. Good morning, Dr. Abiola.
Good morning. Glad to see you live and in person.
Yes, it's so good to have you right here with us in the studios.
Same here. Thank you.
All right, our radio doctor for today, Dr. Abiola, will be consulting and advising on common medical myths and home remedies. I know you've heard a lot. So today, we will be talking about some of the myths that you've heard, and of course, we'll be debunking them and tell you the reality of life. I know some people have said that, for you to have enough blood running in your system, you should try and combine blood. It would help you. I wouldn't know if that is a myth, but Dr. Abiola is right here to help us, debunk some of this myths. To be a part of the conversation, you can call 07000 or send a text or WhatsApp message to 0703 175 6537 or 703 175 6537 to ask whatever question you want to ask about your health. Dr. Abiola Ajayi is right here to provide answers to your questions. All right, Dr. Abiola, let's delve right into the conversation.
Sure.
Let's start with this particular one. What are home remedies?
Home remedy is when you're trying to use ingredients commonly found in the home or around the home to make medicines. Medicines we use to treat sickness.
Okay.
So that's the easy definition. And when a lot of people would, let's say, make jest of a home remedy, I always remind people that when medicines were started, they actually came from most medicines came from plants or came from some other thing that was found in the home. One of the first antibiotics, penicillin, was found as a mold on bread. So and they started doing experiments with it and having antibiotics. That's that's at least 100 years ago. But anything used in and around the house to try and treat an ailment is a home remedy.
Well, it has been said that, you should not treat yourself at home. You should go to the hospital. What do you have to say to this?
Yeah, very, very true. And so when we're talking about home remedies, we have to be very careful. What are we treating? If we're treating something well known, for example, I woke up this morning, my left ankle was hurting. I know I was playing basketball with my kids and I rolled my ankle. So I took a cold compress from some cold vegetables actually from our freezer and wrapped it around my ankle, and that made me feel better. That's fine because I knew exactly what I was treating, not because I was a doctor, because I know what happened and something that's happened commonly. But when it's something that that's happened commonly, but when it's something that that you don't know, that you're not aware of, then you don't want to treat that on your own. That's the best advice.
All right, thank you so much, Dr. Abiola, for that one. Now talking about home remedies. Now I would like you to enlighten us on the importance of home remedies, because some people would say, no, I don't want to do it. It is whatever the doctor says that is fine now. So what is the importance of knowing about some of those home remedies?
The importance is great. I've been lucky enough to travel all over Nigeria, all over the world really, but especially Nigeria. And I'm technically from Edo State.
Oh.
I'm from a very small town called Igara, in Edo State. You're from where your father's from, right? So
yeah,
that's where my dad's from. That's where I'm from. And there's only one doctor and I know his name. I won't say his name on the radio. There's only one doctor.
Okay.
And so imagine if he was 10 miles away
Mm.
and your loved one has an issue.
Yes.
You better know how to treat it. And I remember one time I was in better know how to treat it. And I remember one time I was in ER and I had stomach upset. My stomach was running. And I was walking around with my grandma when she was alive then, and she just told my uncle, climb this tree, don't pick that branch, pull that thing down. Climb the tree, put some leaves, and she said I should be chewing it. And 15 minutes later, my stomach felt better.
Okay.
Yeah. And so I said, so that amazed me. I remember I was probably like 15 then. That really amazed me. That how did she just look up in the tree and know what to use?
Do.
So in places where a hospital is not around the corner or a doctor is not readily available, and you have a chronic ailment, you need to know how to treat it, or how to at least alleviate it until you can get to medical attention.
Okay, so what are some of the basic home remedies that we should know as individuals?
Well, there are a lot. I'll start with since we're on Women's FM.
Yeah.
I'll start with one that I learned early on about women, and women get them more often than men for different reasons. And cranberry juice. I don't know if you've ever heard about that.
Yeah, I have.
So cranberry juice and treatment of urinary tract infections is a well-known home remedy. I'm not saying you treat the most serious ones with it and you do all of that, but it's now medically proven. Plenty of experiments where those that routinely use cranberry juice have less urinary tract infections.
Ooh.
And even if you start drinking it while you maybe start having the symptoms of urinary tract infection, burning or frequent urination. By the time you start, it actually acidifies your urine and it actually helps kill some bacteria.
Oh, this is like the first time I'm hearing.
Really? Yeah. So this is the one that's that I've seen work. I know it works. And but I wouldn't today have a patient give me some urinary tract infection and tell them, hey, just go home and drink cranberry juice. I'm not that kind of doctor. But if you know that you're somebody that gets those kind of infections frequently, then add it to your diet and see what happens. You may see that you have less.
Is it healthy?
It's cranberry juice. We have the natural one that does not have added sugar.
Okay.
It's not. And I think we'll talk about sugar later on in this.
Conversation.
Yeah. So when you're talking about cranberry juice that is not added sugar, there's no problem with it. We're not talking about drinking gallons.
Okay.
Oh Lord, let me say, I'm not in the U.S. anymore. Liters. We're not talking about. You're talking about drinking liters of it. Yeah. We're just talking about drinking, a glass or two a day.
Okay.
That can definitely help.
All right. So go on. You just started with this one.
Well, that's a good one. Another one from sore throat, especially now when we start getting into the drier. And I'm still someone's gonna have to teach me what hammer thing means. So, I'm embarrassed to say I'm not exactly sure, but I just know it's dry.
Okay.
So when you start having sometimes sore throat, or irritation, you can go dental work. They tell you to gargle with salt water, and the reason is because it kills bacteria. Ooh. So that's actually quite useful.
Wow, this is really, really, really.
I didn't know you were going to ask me so many.
Really interesting. Yeah. Really
I can give you one more.
Okay,
that I actually got since coming to Nigeria. Turmeric.
Yeah.
I never cooked with it. I actually like to cook.
Okay.
My mom learned me. Taught me a lot. But I started using turmeric when I came to Nigeria because it's plentiful and actually reduces inflammation. So when you have pain and other things like that, turmeric is actually quite useful. So when I make food, I add it to almost everything I make nowadays, and it reduces inflammation. It's not as strong as taking like a couple painkillers, but when you add these things to your diet, it can reduce the symptoms overall. So and I've noticed that in my own life, it makes a difference. So.
Wow, thank you so much, Dr. Abiola, for sharing that with us on the show today. This is Already Doctor on WFM 91.1 0.7 for sharing that with us on the show today. This is Radio Doctor on WFM 91.7. You can call 07000 917 917 or 7000 917 917 or send a text or WhatsApp message to 0703 175 6537 0703 175 6537. Now let's talk about some of the medical myths that are not true.
Okay.
So I would like you to enlighten. A child. A lot of people say that, oh, if you want to have enough blood in your body system, you should try to, take a mixture of malt and milk. How true is this?
Yeah, I cannot. I'm a scientist that, basically a scientist, and I cannot find the scientific reason why that would work. I actually heard that too from, grandparents, and I honestly don't know why anybody thought that.
Okay.
The most common cause of, when you say low blood, that's what we call anemia.
Okay.
The most common cause of anemia is low iron content. So if you want to increase, we have things like ugu, ugu,
Yes.
efo.
Okay.
Any of those dark green vegetables, they have high iron content. So if you ever add those to your diet, you'd see your blood levels go up faster.
I appreciate you. I know that some people have said that when you take so much carbonated drinks, it actually increase your body size. But I've seen people who literally consume carbonated drinks every day, and you just see them, they still look so skinny.
Yeah, I was one of those people. When I first came to Nigeria, I've been here probably like 7-8 years now.
Okay.
I go back and forth. I was in the States just a couple months. When I first came, I used to drink about 5 or 6
a day
per day, easily.
Ooh.
Easily per day. And if I show you a picture of me then, I look like a stick.
Ooh.
And so the reason why you have those kind of people is because of your metabolism. Typically, those people have high metabolism. They're going to burn off whatever calories they have now.
Okay.
Now I take probably and if anybody wants to wants to get where I got, take a bottle of your favorite dark carbonated beverage with a red label. I won't say the name, but we all know what we're talking about.
Yes.
Find a rusty nail.
Okay.
And drop the nail in the beverage and close it. Come back 2 days later and look at that rusty nail. It'll look brand new.
Ooh.
All the rust will be off of it. So do I want to be ingesting something that can remove rust from nails? Probably not. Probably not.
It sounds really scary.
It is. I've done it. I've done that experiment. Oh yeah, and I challenge some of my patients that find it hard to get off of the minerals. They're called minerals for a reason. That was a marketing ploy to make us think that they're helpful and we want to ingest them more. There's nothing really advantageous to taking those drinks.
All right, thank you so much for that one. So let's talk about this other one that I've heard, and this one is about the fact that it's important for you to feed your child like an egg per day because it helps for you to feed your child like an egg per day because it helps with the brain. How true is this?
That is not true. Now, eggs have been vilified, or eggs have been, a lot of people have make eggs out to be bad. They talk about bad cholesterol and egg yolks are terrible. And we've gone back and forth with that in the medical literature. The current thing is that all cholesterol is not bad cholesterol. And what a lot of people don't know is that every cell in our body has cholesterol. We require cholesterol. It makes up our cells, the membrane, like what actually makes up the cell. So we need some cholesterol. And an egg yolk does not have full of the bad cholesterol. It has something called HDL, which is one of the better cholesterol. So a child eating an egg a day is not a terrible thing, but in terms of direct with brain development, I don't know how I could link the two, but I can't say it's terrible. It's bad for a child to have an egg a day. I have twins. One of my kids, and I'm allergic to eggs, so I can't even smell them. If I smell them, I start getting nauseated. But one of my kids can eat eggs, the other one doesn't, like me, and they're both as sharp. Even the one that doesn't
Doesn't
even
eat
eat eggs.
eggs.
He was number one in the class this time. So
Ooh.
it's in terms of brain development, there are a lot more things you can do than just feeding them the egg. It's the type of stimulus you give the child that's really important.
All right. So talking about some of the things we can actually do as parents to help our children, can you just tell us some of the things you can do?
Get them away from the iPad.
Okay.
Number one. One of the easiest things to do is, child's unruly or just disturbing you from your work, and give them an iPad. That's the worst thing you can do.
As a parent.
That's probably one of the worst things you can do, because especially one that's connected to the internet, because they're trying to program our children through these different apps and everything to become consumers, not to become scientists, not to create anything, not to do anything. So my kids and I'm not saying I'm a perfect parent. It's my only kids I have. Well, we do something every Friday, call it Friday night dance party.
Yeah, you mentioned it on the show.
But on top of that, we do machining, so we make stuff.
Okay.
So like all my kids, so we make stuff.
Okay.
So all my kids, I say bring me a socket, they know the socket, they know spanners, they know wrenches, they know different flathead, and they're 7. Wow. So we build stuff together. We built a racing rig. We connected to the computer. We can race on it. We build all kinds of stuff, and that 2 hours a week is far more beneficial to them than a lot of other stuff we can do.
I totally love it.
I totally love it. And then we dance.
I totally love it.
And then we
all
dance,
right, this is 20 minutes gone past the radio. If you are just joining this conversation, this is Radio Doctor on WFM 91.7. Radio Doctor is your free health consultation program where real doctors advise real people. Radio Doctor is Nigeria's first specialized health program where medical doctors consult for free and advise on human radio. And of course, it is being broadcast 10 a.m. Mondays through Fridays. My radio doctor for today is Dr. ABIOLA AJAYI, is the MD of REMEDIES Specialist Hospital. And today we have been talking about the common medical myths and home remedies. There are ways by which you can join the conversation. You can call 7,917 or 7,917 or better still send a text or WhatsApp message to 0703 175 6537. Follow us across the social media platforms to drop your contributions on Facebook, Instagram, Twitter, and YouTube. WF Facebook, Instagram, Twitter, and YouTube. WFM, Instagram, Twitter, and YouTube. WFM 917. Log on to our website, www.wfm917.com, to listen live from any part of the world. All right, still talking about the myths that we've heard. I know this one is very, 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 common and popular, and this one is about spicy foods. Okay. I've heard over time that people would say, "Oh, when you take too many spicy foods and you stress yourself, you can actually develop ulcer."
That's 100% true. That's 100% true. Maybe for reasons that other people may not know, but when we have something called the esophagus, is a tube that connects our mouth to our stomach.
Okay.
And when at the junction between that tube and our stomach is a muscle called a sphincter. It closes. Our stomach's full of acid. Okay. So our esophagus, the tube in our chest, should not have acid in it. When it does, we have something called acid reflux. Everybody has felt that, where you start having. So that muscle is meant to keep the acid from going up. Stress, spicy foods reduces the strength of that muscle, and other esophagus as well as it was before. So that's 100% true. Stress also increases acid production, and a hormone called cortisol, which is a stress hormone, can also do that. So that is very true.
All right, so let's talk about ulcer for a bit. Like the peptic ulcer, which is the ulcer in the
peptic ulcer means either stomach or the first part of your small intestine.
Okay.
So you have that's called gastric ulcer.
Okay.
Or duodenal ulcer.
Okay.
Both of those combine to make peptic ulcer.
So at what points do you know you have ulcer?
Well, you'll have the symptoms.
What are the symptoms?
Well, you'll have pain, and it's called epigastric pain, and that pain is if you everybody has a breastbone that touch that breastbone, keep going down until you get to a soft spot. That's usually a sign of either an ulcer or GERD. That's gastroesophageal reflux. It's just reflux, meaning acid is going backwards. So if you start having pain in that area, that's usually the first sign.
Okay.
Other signs are gassiness,
okay.
bloatingness,
Okay.
and something called early satiety, meaning you start eating and you get full really quickly.
Okay.
So all of those are signs of either peptic ulcer or something hyperacidity, just increased acid in the stomach. If you have increased acid over time, you know, just like acid does, it's going to eat through. Ulcer is an erosion of normal skin or normal mucosa. Actually, is a lining of our stomach. So the acid actually has eaten through that lining. If it's untreated, it will continue to eat through. It can even cause bleeding. And I've seen I had a patient earlier this week that was so bad they had bled down. Their blood level was like 11% from stomach ulcer, and that was because the person routinely abused alcohol.
Okay.
You know, so there are many things that can lead to the what we call unopposed acid, meaning you get acid and nothing there to soak it up. So if you wake up and rush to work, rest, and you're half faces traffic and do all of that, your acid is building up, and you don't have any half faces traffic and do all of that, your acid is building up, and you don't have any stomach, that will eventually come back to life.
All right, thank you so much, Dr. Abiola, for that one. So let's talk about this myth. I wouldn't know if it is a myth or it is a true saying. You know, over time I've heard people say when you have pains at the side of your belly, let's say you have pain at the side of your left side of the belly, some people have associated that to ulcer. How true is this?
Typically, I would say less likely, but I would like to say nine out of 10 times it's that area that I mentioned before, the epigastric. When you start having pain in the lower part of the belly, it's usually something else. If it's something else, if it's a woman, it may be something to do with her ovaries. Because ovarian pain can be on either side, on the left or the right side. If it's a man, it could be and a man or a woman, it could be appendix. You know, on the lower part of the abdomen. So you always keep those things in mind. If you're having sharp pain in your lower abdomen, especially to the point where it's maybe you lose your appetite and you don't really feel like eating, you really should have yourself checked out, because appendicitis. Appendicitis is a surgical emergency. Yeah, it's not something that you watch or you treat with medication. It's something that you go in and remove the appendix and keep on going. I had mine removed and keep on going. I had mine removed electively before I had any problem. I had a particular procedure, and I just said, while you guys are in there, remove my appendix so it doesn't give me problems later on. So you just want to watch out for that. If you have women, especially women in childbearing age, they have ovarian cysts or some in age, they have this routine lower abdominal pain. It may be ovarian cysts or some kind of ovarian issue, and those can easily be seen on ultrasound.
So you need to go.
Go see your doctor, get a proper scan done, and the best time to do the scan is when you're having the pain. So, because I've had women come and say, yeah, I had the pain, it was terrible last week. I don't have it now, but I want to have a scan. Like, okay, you're going to be wasting your money because we're probably not going to see what was causing the pain. So when you're having that pain, that's the best time to do the scan, because we can see if there's cysts, how large they are, and if it's something else, we can also see what it is and treat it appropriately.
All right, thank you so much for that one. I really do appreciate you. Let's check out more myths. I mean, it has been said that you can't get pregnant when you're menstruating or when you're breastfeeding.
Yeah, that's it's mainly true. God created it like that for a reason. You know, we used to live in caves. We used to run from lions and in the bush before we were a civilized society. So it'd be very difficult for you to be breastfeeding, pregnant, running away from a lion, right? So there's a hormone that your body produces, a woman's body produces, called prolactin. That when that hormone is high, you're producing milk. but it also serves as kind of like a natural contraceptive, meaning anti-pregnancy. But these are not 100% true. So it does happen sometimes that even though you're breastfeeding, you do get pregnant. I've seen patients with that. And then also while you're menstruating, I've had people.
Yeah, I was going to say that.
I've seen it. I've seen it too, but it's not as common as you think, because the sperm can actually last long in the canal. So it's true to a degree. I would say majority, but there are the exceptions.
All right, thank you so much for that one. Now let's talk about this one. When you exercise at night, you can probably ruin your sleep. How true is this?
That's false. That's completely false. In fact, you can probably improve your sleep. I'm one of those kind of people. I exercise at night. I do my gym work in the evening, and I usually fall asleep. I can usually fall asleep. Yeah, within 40 minutes, I can sleep. If I don't, probably take me 5-6 hours to sleep. Or sometimes I don't sleep. I'm just up reading, doing other things. Times I'll sleep till like 6, 7 in the morning. But if I did my exercise that night, like 7, 8, 9 p.m., I'm asleep before midnight. So it will not reduce your sleep. In fact, those that exercise regularly, regardless of the time of day, have better sleep patterns than those that do not. And exercising at night will improve your sleep, definitely.
All right, thank you so much, Dr. Abiola, for that one. When you eat, okay, I think I've said this, and you mentioned it already about the cholesterol in eggs and all of that. So I think you've touched that part already. So let's talk about natural sugars and refined sugars. And I've heard people say, "Oh, brown sugar is the best. You should take less white sugar is the best. You should take less white sugar. Go for brown sugar." How true?
Yeah, we'll talk about natural versus refined sugars.
Okay.
Natural sugars are what are natural sugars?
Okay.
For example, I eat an apple. An apple tastes sweet. It has natural sugars in it, and those are the better types of sugars to eat, because combined with other compounds, so the sugars are broken down slower. They don't create big spikes in our blood glucose. Blood glucose is our sugar level.
Okay.
So if I took a spoonful of refined sugar, immediately our blood glucose level is going to jump up, and then it crashes shortly after, and that causes all kinds of havoc on the body. So just answer that question simply, yes, natural sugars are by far better than refined sugars. And then when we look deeper and you look at the refining process, you're usually stripping away a lot of the nutrients that are useful, and the process even adds some things that may cause cancer down the road. So I'm not saying all, because I don't know all, but I would, if I could stay away from refined sugars, I would. And when we say refined sugar, we see those a lot in cookies, candies, cakes, those kinds of things. Especially cakes that I see here. We have this thick, I don't know what they call it. It's this thick thing they cover the cake with. Maybe it starts with an F. I don't know. I'm not a big pastry guy. Okay. But that big, you have cakes that has this thick layer on top of it, and then you have the real cake inside.
Okay.
Yeah, that is full of refined sugar. That's probably one of the worst things for you. So we try to avoid that as much as possible. Besides the fact that it's going to add probably to your weight, there are a lot of chemicals and things in it that you don't want in your body.
All right, since you mentioned weight, I think we should talk about this one. Sure. I know that a lot of people have tried over time to lose weight is very hard.
Right.
Doing exercises, I have seen and I've heard people say that, the moment they started exercising, I mean, they added more flesh.
Okay.
And some people would say, oh, it's been really difficult. They're doing it for like, let's say, months, and they are not seeing changes. So if we want to tone down our weight, what are some of the things that we need to put into consideration?
Number one thing you need to know is that 70% of weight loss is diet. Nothing with exercise. 70% of it is diet. The second thing you need to know is that starving yourself is the wrong thing to do. Because as soon as you start starving yourself, meaning skipping meals, your body's metabolism starts slowing down, because your body doesn't know that you're trying to lose weight. Your body doesn't know what you're trying to do. And So that's typically what causes people to, they think they're dieting, they're eating just once a day, and they're not going anywhere because their body's hanging on to those calories because it doesn't. It's like I'm only going to see food once until it will now hang on to everything. So like typically how I manage my weight, I eat multiple small meals a day, cycles a day. So I eat 5 times a day with small meals.
Okay, at intervals.
At intervals. So my body's constantly burning food because it knows, hey, I'm ready for the next one, and it'll burn that and burn that and burn that. So that's those are if you can focus on those two things, you'll see most of your gains will start coming back. And then the 30% of it is exercise. The exercise you want to do is not lifting of heavy weights. If you start moving weights, you're going to start getting muscle, and muscle weighs more than that. If you can do aerobic exercise, so we call them aerobic exercise, you're increasing heart rate, you're sweating, then you're going to start burning calories. And you want to, basically, when you want to lose weight, you want your body to you want your body to start burning fats, instead of burning your other things like sugars and things. You want your body to burn fats even while you're sitting down. So I'm that kind of person too. I'm sweating constantly, but my metabolism is quite high, so I'm constantly burning fats even while years of programming my body. So we can all do it. Just take some discipline. But once you do it and you get used to it, your body will get used to it. The third advice I would give is to intermittent fasting.
Okay, so how does that work?
So it's not this dry fast that I see people doing. That is very scary to me. Intermittent fasting is where you take a portion of the day and you can take water but nothing else. And some of them, it depends on who I'm dealing with. I'll do 12-12, that's 12 hours on, 12 hours off, or 18-6, 18-16, where you 8-16, where you eat anything you want for 8 hours, and you fast the hardcore one. Okay. Which, so I don't start people on that.
Okay, so I think a lot of people have heard what we call intermittent fasting, but we're getting it wrong.
Yes.
So I'm glad that you're taking our time to really explain this one. So you're saying that if I want to embark on intermittent fasting, it means that within a particular frame, I have to eat everything I want to eat.
Yes, you eat what you can, and typically what I tell people, eat what you want. Don't try and try and eat as healthy as possible, right? Don't just eat cakes, but eat what you want. But when you're in the fasting period, it's only water. You can take no coffee, no vitamins, no Coke, just water. Because once you take anything besides water, you start your metabolism up again, and you've now ruined the fasting.
Okay, so let's assume that a patient is listening to you right about now.
Sure.
How do you advise the intermittent journey?
I'll probably start on the easier one. Probably 12. It's probably 12-12. Okay.
What does that mean?
That's 12 hours on, 12 hours off. So the 12 hours on, you're eating what you want. Try to eat as healthy as possible, and then for the other 12 hours, you're drinking just water, and you try and do that as consistent as possible. I give you one cheat day a week. Okay. So one day a week, you do what you want to do that day. It will not ruin the cycle. If you do it more than a day in a week, you will start affecting the gains. Excuse me. So that's where I would start. And do it for a month and see. And see what happens. The good thing about intermittent fasting is that it promotes fat burning and saves muscle. So you'll see that you'll still have your muscle mass, but your fat will start dropping off. And you won't believe it, but a year ago I was about 50 pounds heavier than I am now. And this intermittent fasting, I used that drop of weight.
Okay, so still on this intermittent fasting. Sure. I mean, let's say you said 12 hours on, 12 hours off.
Yeah, that's the easiest
Okay, so I'm saying that. So let's say if you start eating at let's say 8 a.m., it means that you have to eat for the next 12 hours.
Yeah, it's not that you have.
You should eat.
Yeah, you start eating at 8 a.m. You may eat something small at 8, something small at 12, something small at 4. something small at 8 p.m. again, and that's it. And then from 8 p.m. to 8 a.m. the next morning, anything that goes in your mouth is water.
Okay.
That's it. It's water.
Okay.
And do that for a month. Start your, you can record body fat as a way to check body fat with some calipers, and you can also weigh yourself. Do that for a month and see. You'll see a big difference.
All right, do that for a month, then you'll see a big difference. I hope that you get to call back to the show and say, "Oh, Camila, I did this, and I did it, and this is it."
I don't mind the challenge. It takes 4 to 6 weeks before you see
the
result.
But so you will eventually see the result.
You will. Just give it at least 4 to 6 weeks, and you'll see the result.
Hey,
nothing good is overnight. There it is.
You should actually take up this challenge. All right, this is 20 minutes right before 11 from the side of your radio. This is Radio Doctor on the BFM 91.7. Radio Doctor is that radio house program where doctors consult for free and advise you based on your health. And of course, it's been broadcast Monday through Fridays, 10 a.m. to 11 a.m. My name is Blessing Agbeto, and our radio doctor for today is Dr. AJAYI, is the CEO of ROA Specialist Hospital. To be part of the conversation, you can call 07000 917 917. You can also send a text message to 0703 175 6537. So I think you should just send us a message or call in to tell us the medical myths that you've heard, and Dr. Abiola will be here to tell you either it is true or not. So what medical myths have you heard over time? I've mentioned the ones I have heard, so you too can call in or send a text message to tell us some of the medical myths that you've heard, and Dr. Abiola will be here to tell you, okay, so this is true. Oh no, this is not true. Point 7. And if you want to listen live, www.wfm917.com. Download our mobile app, WFM917. Send in your contributions to our social media platforms. And as a matter of fact, we're live streaming now across our social media platforms, so you can check us out at WFM917 to be a part of the conversation. So let's talk about this. As a child, I heard this and I saw people do this. And this is how people will place metal spoon in the mouth of a child convulsing. How true is this, or how medically advisable is this?
Do you know a funny story? This happened to one of my staff just yesterday, 2 days ago.
Okay.
So I won't name the staff, but she ran into my office that my child was convulsing and they stuck a spoon in his mouth, and she's running to the hospital. To the school to pick the kid said, "Well, call me when you get there."
Mm-hmm.
To be very simple, don't put anything in anybody's mouth when they're convulsing.
I know some people don't put their fingers.
Yeah, that's so.
Fingers.
Yeah, that's so. Just to be very simple, do not put things in people's mouth when they're convulsing or having a seizure. You have more chance of doing harm to the person than doing good. What's the reason for putting the spoon? We say we don't want them to swallow their tongue. Your tongue is attached to the back of your mouth. You can't swallow your tongue. So it can go to the back, and it can flap back there. It can cause snoring. It can cause them to gargle. But there's no way to swallow your tongue into your stomach. It's just physically not possible. You stick a spoon, especially a metal spoon or something like that, into a mouth, and they clamp down on it. They can break their teeth. They can start bleeding. The spoon itself can actually cover the windpipe in the back of the throat and actually cause worsening of the issue. You don't want to put your hand in the person's mouth and try to get their phone. If you have a child with a known seizure disorder or known disorder, you should already have a plan in place that even your medical professional have had, that this child has this issue. This is what we're going to do. We're going to roll them on their side. I
was going to ask you, since we're talking about home remedies, so let's say you find someone in your environment, going through that challenge. What are you supposed to do?
Yeah, the thing I wouldn't want to happen to that person, because they're not in control of their body at that time. I wouldn't want them to roll over face down and suffocate themselves. So that would be terrible. Somebody's in the bed, maybe convulsing, they now roll over on the pillow, and they're now suffocating themselves. So I would want to roll them onto their side, so that the if the tongue would hang to the side, any excess saliva would also come out of the mouth, and will allow them to finish their seizure. I would like to speak calmly and soft. I want to start shouting and saying Jesus, because whether you believe it or not, that they're actually can hear you even though they can't respond.
Ooh.
So, and then they can also feel your energy. So when you're panicked, you're actually making them more panicked. So if you can, and I know it's hard when the mother making them more panicked. So if you can, and I know it's hard when the mother or child or father seeing the child go up that, but you need to be the calm one. Start speaking calmly to the person, roll them on their side, and just watch them. And just
without putting anything in their mouth.
Yeah, I do not recommend putting anything in anybody's mouth. I cannot do that safely. And you know, when I talk here and whenever I give anything like the fact, it's usually because I'm using guidelines that either from
medical guidelines.
Yes, either from American Medical Association, World Health Organization. I don't make stuff up.
Claims.
So that's the recommended way.
All right, thank you so much, Dr. Abiola, for that one. And I'm glad we've been able to learn something. So when you have someone convulsing or having seizure beside you, instead of just sticking your hand into the person's mouth or sticking iron spoon into the person's mouth, just try as much as possible to roll the person to the side and stay calm.
Stay calm.
Stay calm. Just
stay
be
calm
there.
And support them.
Yeah, stay calm.
You can rub their back. You know,
okay.
you just be speaking calm words to them and wait for it to cease.
Okay. All right, thank you so much for that one. Let's talk about microwaving food. I know I've asked you this before, and I'm really interested in this one. People have said that you shouldn't microwave your food because if you take too much food that have been microwaved, you could or this could breed cancer. How true is this?
I'll say yes, it is true, but for different reasons. A lot of us microwave our food in the plastic containers we get at the takeaway bags.
Yes.
All right. And those plastics, by the time you microwave, the plastics now release chemicals into your food. And those chemicals are known carcinogens. These are not a guess. These are things that over time we know will definitely cause cancer. So that's one thing you don't want to do. If you must microwave your food, transfer it to a microwavable safe plate and microwave it.
Okay.
Now, if we now talk about microwaving in general, I like to quote an experiment that I've conducted and I've also witnessed before, where we took plants. I did this in one of my biology classes. We took 10 plants on this side and we microwaved the water, let it cool to room temperature, and then watered the plants. And then the other plants on the other side, we just used the microwave. 100 times out of 100, the plants that got microwave water did not grow as well as the other ones. I couldn't tell you exactly why, but we know that microwaving changes the chemical composition of even water itself, and may denature. Denature meaning breaks up nutrients. So we have different types of nutrients dissolved in water. Water is not just pure water. So by microwaving it, you denature them. You break them into pieces that may not be usable by the human body. So try to avoid microwaving, but you can't nowadays in our society. We can't avoid it completely. So if I can, like my wife knows that I don't like to give me food. She can give it to me straight out of the fridge. I'll eat it just like that. I don't mind, but occasionally we still have a microwave. We do use it occasionally, but
not all the time.
I use it occasionally, but
not all the time.
I rarely do.
All right. Thank you so much, Dr. Abiola, for that one. Okay, so let's talk about this one as well. Growing up as a child again, I've heard this, and even as an adult, I've heard this. So people have said that when you consume curry a lot, it can affect your eyes. How true is this?
That one you got me on. My for Gary and I'll have to talk about my dad now because he grew up very poor and ate Gary a lot. Okay. And the problem with it is that there's not a lot of nutrients. There's not a lot of varied nutrients in it. So I wouldn't know about nutritional deficiencies, but in terms of just your eyes, I couldn't really speak on it. If we talked about one of the myths is that carrots give you better eyesight. I don't know if you've heard that before.
Okay.
That eating carrots can improve your eyesight.
Mm.
Yeah, that's a common myth. And if we tackle the myth, we look. There's something called beta carotene that's in carrots, and we know that that actually helps eyesight. Vitamin A also, we know that can also help. Gary does not have vitamin A and does not have beta carotene. So if I were to go by association, I'd say probably maybe that is true, but I couldn't say for sure.
For sure. All right,
I've eaten Gary, but I've not eaten enough in my life.
Okay. All right. Thank you so much for that one. I think I should ask you this very last one.
Sure.
The sun is good for my skin. I mean, the early morning sun is the vitamin D, so I should sun dry myself. For vitamin D.
Sun dry yourself.
How true is this?
You won't like yourself if you sun dry. So you mentioned something that was kind of true. For us to vitamin D and calcium make strong bones, right?
Okay.
So for us to get the active form of vitamin D, and I won't give the name because it's extremely long, 125 calciferol. Yeah, the long word has about 30 letters in it.
Wow.
But to get the active form of vitamin D, we need ultraviolet light.
Okay.
And that's what we get from the sun.
Sun.
So you don't need to sun dry or sun bake yourself. You need about 20 to 30 minutes, a minimum in a week, to maintain levels. So, and I'm inside a lot as a doctor, so I just get it from when I walk around my compound or so. So yes, sun is important for vitamin D uptake and calcium uptake, but please do not bake yourself. What we'll now start seeing if you have too much sun is skin cancers. And of course, blacks have less degree of skin cancers than whites. I'm coming from U.S. a white country. I've seen skin cancer a lot, but I saw my first case of skin cancer in Nigeria this last year, which I removed and made the scent off, and it was something called melanoma, which is a very serious form of skin cancer. So blacks can get skin cancer, especially if we're in the sun for so long. So if you know that you're in the sun for so long. So if you know that for example, you work on your construction site, you work on the road, there's nothing wrong with using sunscreen.
Or hot.
Yes, or a hat or something else exactly to shield you from the ultraviolet rays. A little bit is good, a lot is terrible.
A little bit is good, a lot is terrible. I mean, I think I like that because I feel like in this part of the world, we are extremists. Yes. I mean, when you tell people do this, we want to do it on the extreme. Yes. When you say, oh, take this, you just want to do it overboard. So yeah, you have it. Just a little is okay for the body. All right, so we have to go now. But just before that, I want to ask you this one already. Let's talk about cold. I mean, is it a sign of fever?
Cold?
Yes.
Is it a sign of fever?
Yes.
What do you mean by that?
Like when you have cold, is it like an early warning sign that you're going to come down with fever?
Oh, okay. It's possible when you say you have a fever. Fever is your body's response. Your body is trying to actually kill bacteria. So by raising your body temperature, it's trying to raise the temperature to where it's uncomfortable for the bacteria. So it's a protective mechanism. So actually what I do now, which I learned from treating COVID patients in the States, I went and I did an intensive care rotation. At least 100 COVID patients. And I learned that by keeping their body temperature high, not breaking the fever, it actually helped. So keeping their body temperature about 39.5 degrees actually helped reduce the virus replication, the virus reproducing. Rather than the first thing you see fever, you want to give a drug to break the. My mom got COVID during that. My mom and dad got COVID, and they both had different responses based on started giving her all kinds of supplements and everything. And my dad had been vaccinated twice and had boosters and everything. He had a worse time of it because, we were learning that they had responded differently. So fevers are not always bad.
Okay, thank you so much, Dr. Abiola, for being a part of the conversation.
You really challenged me today.
Dr.
I
Abiola is
appreciate that.
the CEO of ROA Specialist Hospital for consultation. You can reach out to Dr. Abiola Ajayi and the CEO of ROA Specialist Hospital on 0913 579 5108. Let me take that again. 0913 579 5108. Thank you so much for coming on the show today.
My pleasure. Thanks for having me.
All right, this is where we get to wrap up on the show for today. Many thanks to you for being a part of the conversation. Thank you, thank you, thank you, thank you, thank you. Honestly, I had to grab my pen because I wrote it down something. So I really do hope that you have been able to learn one or two things from the show today. My name is Blessing Agbejon. Doctor, we will be back on Monday. Do well to join us. Many thanks to my producer, Elizabeth Aquaribe. My name is Blessing Agbejon. Good morning. To sponsor this program, call the number
Yeah, I'll have to call the
480
you have to also
734
Okay.
listen to it.
Hi there, my name is Mercy.
Thank you so much.
I enjoy.